Okay, good afternoon and welcome to today's U.S. Food and Drug Administration stakeholder call on the agency's proposed tobacco product standards related to combustible tobacco products. I'm Dale Crescenzio with the FDA's Stakeholder Engagement staff. In a moment, I will turn it over to Michele Mital, Acting Director of the FDA Center for Tobacco Products, and Rear Admiral Chardae Araojo, FDA's Associate Commissioner of Minority Health, to provide remarks. After the remarks, we will move to the question and answer portion of the call, where Acting Director Mital and subject matter experts from the Center for Tobacco will be available to answer questions. Members of the public on the phone will be in a listen-only mode until we open up the call for questions. As a reminder, this call is being recorded and will be posted on the FDA's YouTube channel. With that, I will now turn the call over to Acting Director of CCP, Michele Mital.
Thank you, Dale, and good afternoon, everyone. Today we announced two proposed product standards, one to prohibit menthol as a characterizing flavor in cigarettes, and one to prohibit all characterizing flavors other than tobacco in cigars. Using one of the most powerful regulatory tools Congress gave the FDA, these proposed product standards, if finalized, would represent a public health victory, helping significantly reduce youth initiation and increase the chances that current smokers quit. Additionally, today's proposals also represent an important step in advancing health equity in our country by significantly reducing tobacco-related health disparities. Fundamentally, these bold actions are about saving hundreds of thousands of lives. Each year, 480,000 lives are lost prematurely from a smoking attributable disease, making tobacco use the leading cause of preventable death and disease in the United States. Menthol is a flavor additive with a minty taste and aroma that is widely used in consumer and medicinal products due to its reported cooling or pain-relieving properties. Menthol's flavor and sensory effects make menthol cigarettes more appealing and easier for new tobacco users like youth and young adults to use. It also interacts with nicotine in the brain to enhance nicotine's addictive effects. Studies show that youth menthol smokers smoke more frequently and are more physically dependent on nicotine than youth smokers of non-menthol cigarettes. Nearly half of youth who have ever smoked cigarettes initiated smoking with a menthol cigarette. But imagine if menthol cigarettes were no longer available in the United States. We know the majority of smokers want to quit. Prohibiting menthol in cigarettes would mean over 18.5 million menthol cigarette smokers ages 12 and older in the United States would have a better shot at quitting. This translates to better health and lower risk of premature death. Furthermore, prohibiting menthol in cigarettes would reduce the likelihood that youth who start using menthol cigarettes will progress to regular use. And estimates show that if menthol was no longer an option in combusted tobacco products, up to 654,000 deaths would be avoided over the course of 40 years. This includes up to 238,000 fewer deaths among Black Americans. Similarly, flavors in cigars, such as strawberry, grape, cocoa, and fruit punch, increase appeal and make cigars easier for youth and young adults to use. In 2019, more young adults tried a cigar for the first time each day than tried a cigarette for the first time. According to recent data, about 960,000 middle and high school students had smoked a cigar, cigarillo, or little cigar in the past 30 days. That's a lot of young people smoking these products, and we know that flavors play a big role in that use. Like menthol cigarettes, we also know that there are racial and ethnic disparities in cigar product use. Data show that cigar use is especially common among non-Hispanic Black middle and high school students compared to non-Hispanic white students. Prohibiting flavors in cigars will reduce their appeal, particularly to youth and young adults, and decrease the likelihood of experimentation, development of nicotine dependence, and progression to regular use. It will also increase the likelihood that existing cigar smokers will quit. Quitting smoking is extremely difficult. Cigarettes with menthol are even more difficult to quit. The agency also recognizes the importance of ensuring broad and equitable access to all the tools and resources that can help smokers quit. The FDA and HHS are working with federal partners to make sure the support is there for those who are trying to quit, especially in underserved communities. I know that some are concerned that these actions, if finalized, would result in increased state and local policing and even criminal penalties in some of the very same communities that have advocated for these rules and are expected to see major health benefits as a result. We take these concerns seriously. There will be more detailed discussion of this issue shortly, but let us make one thing abundantly clear. These measures and related enforcement would be on the tobacco industry, not individuals who possess or use these products. I know how important it is to have clarity around roles and responsibilities with respect to federal, state, and local enforcement. There will be multiple opportunities for all to submit comments on how best to do that here. These proposals are an important step forward to decrease the appeal of tobacco products, protect youth, advance health equity, and importantly for ourselves and those we love, save lives. Taken together, these policies will help significantly reduce disease and death from the use of combusted tobacco products, which remains the leading cause of preventable death in the United States. I'm now going to turn it over to Rear Admiral Chardae Araojo, who is FDA's Associate Commissioner for Minority Health.
Thank you, Michelle. Today, I want to speak briefly about the opportunity for the public to provide input on these proposed product standards and the next steps in the rulemaking process. Starting Wednesday, May 4th, all members of the public will have the opportunity to submit either electronic or written comments directly to the dockets on the proposed rules by July 5th. Additionally, the agency will convene public listening sessions on June 13th and June 15th to expand direct engagement with the public, including affected communities. The listening sessions will provide an alternative for all, including individuals, communities, and organizations, to share their perspectives with the FDA as the agency seeks to ensure that all have an opportunity to participate, particularly those with relevant lived experience. In particular, we recognize there are concerns about how these newly proposed product standards would be enforced. It's important to remember that the FDA enforces regulations related to how companies may manufacture and distribute tobacco products and how stores may sell those products. The FDA does not regulate the possession of tobacco products by individual consumers for personal use, and these rules do not include any prohibition on individual consumer possession or use of menthol cigarettes or flavored cigars. In other words, if implemented, these rules would only address commercial activity. That is, the manufacture, importation, distribution, and sale of these products. State and local law enforcement agencies do not independently enforce the Federal Food, Drug, and Cosmetic Act or FDA's tobacco rules. So these entities do not and cannot enforce against any violation of the Act or these regulations on FDA's behalf. However, the FDA recognizes that there are concerns about how state and local law enforcement may enforce their own laws in a manner that may impact equity and community safety. We encourage the public to submit comments on how the FDA can clarify the respective roles of the agency and state and local law enforcement. Comments submitted to the dockets and from the listening sessions will be considered in the process of finalizing the rule. And in closing, I want to bring us back to the historic nature of these proposals, to the hundreds of thousands of lives they would save, and to the dramatic tobacco-related disparities that they would help to address. Years of scientific research and analysis stand behind these proposals, as do voices from a wide array of affected communities seeking better health and health equity. And I am proud to be a part of this important work. Thank you, and now I will turn it back to Dale to begin questions and answers.
Thank you. At this time, we will begin the question and answer portion of the briefing. As a reminder, this call is being recorded. If you would like to ask a question, you may either utilize the raise your hand function at the bottom of your screen so that we may call on you to ask your question live, or you may enter your question into the Q&A function at the bottom of the screen and I will read it for you. Please state your name and the organization you are representing at the beginning of the question. Also, please ensure questions pertain to today's announcement and limit yourself to one question and one follow-up so we can get to as many questions as possible. I'm going to start with a few of the questions that have been typed in while others start to raise their hands. Jeff Sukas, who is from the Nebraska Department of Health and Human Services, writes, regarding comment submission, are comments required to take a position supporting or opposing the regulation? And what does FDA do with neutral comments that do not take a position?
Thanks, Dale. So I'll take that. I can provide a little bit of background on the notice and comment process. So it enables anyone to submit a comment on any part of the proposed rule. You'll see many questions where we are soliciting specific comment. The process is not like a ballot initiative or an up or down vote in a legislature. So agency does not base its final rule on the number of comments in support of the rule over those in opposition to it. And so taking a position on the rule is not required for commenting. And then I'll just kind of to close it out at the end of the process, the agency bases its reasoning and conclusions on the rulemaking record, which consists of the comments, the scientific data, expert opinions, and facts accumulated during the rulemaking process.
Great, thank you so much, Michelle. Next, I'd like to turn to one of our stakeholders that is in the, has his hand raised. It's Gary Ewart. Gary, are you able to unmute yourself so you can ask your question?
Yes, can you hear me?
Yes, thank you.
Thank you. Gary Ewart with the American Thoracic Society. Does the proposed rule define the phrase characterizing flavor? And if not, is the term characterizing flavor already defined in legislation or regulation?
Thanks, Gary. That's a great question. So as part of the proposed rule, FDA provides some factors that the agency believes are relevant in determining whether a cigarette or a cigar has a characterizing flavor. And those factors include the presence and amount of an artificial or natural flavor additive, compounds, constituents, or ingredients, or any other flavoring ingredient in a tobacco product, including its components and parts. So that's one factor. Another factor is the multisensory experience, so like taste, aroma, or a cooling or burning sensation in the mouth or throat, including its components and parts. Another factor is flavor representations, including descriptors, either explicit or implicit in or on the labeling, including the packaging or advertising of the tobacco products. And then any other means that impart flavor or represent that the tobacco products have a characterizing flavor. So those are the factors that we've put forward in the rules. And of course, that is one area that we are soliciting comment from the public as part of the comment period.
Thank you. That is helpful.
Thank you. Our next person in line to ask a live question is Emily Horowitz. Emily, can you unmute yourself?
Hi, can you hear me?
Yes.
Yes.
Hi, my name is Emily Horowitz with the American Heart Association. The association commends the FDA for the two proposed rules, which will have a profound impact on health and health equity and are strongly supported by the science. Looking ahead at the rulemaking process, what does FDA need from stakeholders to get to strong and comprehensive final rules?
Thank you, Emily, and we appreciate the support. You know, as we've said in the past, you know, rulemaking is a participatory process, and so we are strongly encouraging public comment to include, you know, scientific data and evidence that will help inform the next steps of the rulemaking process. So we would just encourage everyone to submit comments to ensure that we have the strongest possible record in which to base the rulemaking on.
Thank you.
I'm going to turn to the Q&A chat box, so we have a number of questions waiting. The first one is from William Robinson, who asks, for clarity, is menthol flavoring being banned on cigars as well?
Yes.
That was an easy answer. The next question is from Lorraine Lathan from Wisconsin African American Tobacco Prevention Network. She asks, what is the expected timeline for this rule to be finalized and adopted into law?
Thanks, Lorraine. That's a great question. So let me just spend a little bit talking about the process. So we are proposing the rules. We're at the proposed rule stage. The public has 60 days to comment on the proposals, and so that comment period opens on Wednesday, May 4th, and runs through July 5th. We will have the 2 listening sessions that we mentioned, one on June 13th and one on June 15th, to solicit additional comment on the rules. And then when the comment period closes, FDA will review all of the comments we've received and then determine what the next steps are in the rulemaking process. So I can tell you that, we don't know, we can't predict how long it will take to complete the rulemaking process because we don't know how many comments we're going to get and we'll need to go through and assess. But I can tell you that we are committed to completing it as expeditiously as possible.
Thank you so much. Our next question is from Shanika Rose from the University of Kentucky, who asks, will these proposed regulations apply to all retailers and online retailers in the U.S., or will there be any exemptions for any retailer type, such as adult-only retailers?
Thanks for that question. There are no exemptions for specific types of retailers. It would apply to all.
We also have a question from Meredith Berkman, who asks, would this rule include VLN, lower nicotine menthol cigarettes?
Thank you for that question. So at this question about sort of exceptions, right, to the rule. So at this time, FDA is proposing that the product standard would cover all products meeting the definition of a cigarette in the Food, Drug, and Cosmetic Act. So this includes all types, sizes, nicotine strengths, and formulations of cigarettes, cigarette tobacco, roll-your-own tobacco, as well as heated tobacco products that meet the definition of a cigarette in the law. However, as part of the proposed rules public commenting process, the agency is interested in data and evidence about potential exemptions, either for certain types of tobacco products on a case-by-case basis, or for tobacco product, including for tobacco products that may have different public health impacts, such as certain heated tobacco products or low nicotine cigarettes.
Great, thank you. We also have a couple more hands raised, so I'm going to go to the live questions now. Carol McGruder, are you able to unmute yourself to ask your question?
Yes. Hi, can you hear me?
Yes.
Yes.
Okay. Hi, good afternoon. Carol McGruder with the African American Tobacco Control Leadership Council. Are there any plans underway that the FDA has to provide some special assistance or remediation for African Americans who were so perniciously targeted with mentholated tobacco products for these past decades?
Hi, Carol, and thank you for joining, and thank you for your work in this area. Just want to let you know that the issue of support and cessation support is one that's critically important, and we are committed, as we mentioned in the opening remarks, to ensuring that, all who need it, including those who are, most affected disproportionately by these rules, receive the support that they will need to have the best possible health outcome as a result of these actions.
Great. Our next question comes from Ash Canada, who has their hand raised. Can you unmute yourself?
Yes, thank you. Hi, I'm Les Hagan. I'm with Ash Canada. And Canada banned menthol tobacco in 2017. We certainly congratulate FDA and everyone who worked so hard in the US to get to this stage today. It's great news. In Canada, tobacco companies have been using brand extensions like smooth and cool and colors like green and blue to imply menthol in cigarettes where it does not exist. In other words, they're using menthol decoys. And I'm wondering if FDA has any plans to prohibit the use of menthol decoys like package descriptors and colors.
Thanks so much for your question. I think that this kind of, goes back to the earlier question about how we are determining and defining and thinking about characterizing flavors and sort of those factors that we will take into consideration as we determine what constitutes a characterizing flavor. And so in terms of the menthol, concept flavors, descriptors that you're talking about, that is one factor. We can't right now sort of speak to the certainty on any particular hypothetical, but it would be relevant to our analysis. And of course, like with everything, we welcome and encourage comments on this concept. Thank you.
Thank you.
Great. I'm going to return back to the Q&A written questions. We have a question from Cheryl Bellis, who asks, when FDA reviews write-in campaign comments, do they count?
Sure. I mean, all comments count, and we carefully review and consider all comments. But kind of back to the earlier point, it's not like a ballot initiative, so it's not a vote. If there's more in support than than in opposition, we look at the substance of all of the comments, but we certainly take into consideration write-in campaigns as well as every other comment.
Great. And the next written question is from Molly Franco from the Power Against Tobacco. Molly asks, should we continue to encourage municipalities to enact their own legislation in the meantime?
Thanks. I'm going to ask my colleague, Robin Appleberry, to address this question.
Yeah, hi. Thank you so much for the question. It's a really good one. I think the first point we would make is that FDA is really aware of the incredible role that state and local health authorities have played in promoting public health in the area of tobacco control over the history of the past few decades. So that's always our starting point, and that's sort of written into the law also. And also note that in the proposed rules, you'll note that FDA did conduct sort of a preemption analysis and found that there would not be any federalism impacts, and we take comment on that aspect as on all aspects of the rules. And I think beyond that, it's not something that we're able to speak directly to what any other jurisdiction should or shouldn't do, but just recognizing the essential role that state and local communities have played in moving public health forward over the years.
Great, thank you so much for that answer. I see that we have another hand raised. I'd like to ask Susan Polan to unmute herself to ask her question.
Hi, thank you. This is Susan Polan with the American Public Health Association. And we too want to congratulate FDA for moving forward on this. It is something we have been waiting for, and are glad to see that the process has begun to move toward final rule. I wanted to follow up on the questions related to the work that you're going to do with other parts of HHS and with state and local, as well as other partners on cessation and prevention activities. particularly as it relates to youth. And if you could talk a little bit more about the specifics of what you have planned to make sure that in the interim, we don't have more kids taking up tobacco.
Thank you so much for that important question. So I just want to reiterate the commitment by both FDA and HHS, across HHS, and the commitment to ensuring that accessible, affordable, and appropriate resources are available to help people who currently use these products. Like I said, we recognize the importance of ensuring the broad and equitable access to all the tools and resources that can help currently addicted smokers seeking to quit, including those who smoke menthol cigarettes and flavored cigars and would be impacted by these public health measures. We're working with our federal partners to make sure that that support is there, and we will have more details in the coming months. I can tell you now there are many cessation tools, as you're aware, and services available at the federal level to help smokers trying to quit. For example, there are numerous FDA-approved medications that are available both by prescription and over-the-counter, including nicotine-based and non-nicotine products. FDA also recently approved the first ever device using transcranial magnetic stimulation as an aid for short-term smoking cessation, but in adults. And that most health insurance plans, including Medicare, Medicaid, and private insurance, are required to cover many cessation treatments. There's the FDA efforts. There's also, as you're likely aware, the National Cancer Institute also has an extensive suite of free quitting services at smokefree.gov, with many services targeted to vulnerable populations, including teens and veterans. And that CDC also is an incredible, important resource for quitting and provides vital information on best practices, insurance coverage, and health systems to state tobacco control programs. There's a lot in place, and we are working to do even more so that we are prepared to fully support all of those who will be impacted by these measures to make sure that we have the best possible health outcome.
I think we have time for one last question, and unfortunately we did not get to everyone, so I apologize in advance. Spencer Straub wrote in the Q&A section, cigarette warning labels have unfortunately been tied up in lawsuits for years now. How do we prevent these rules from befalling the same fate?
Robin Appleberry is going to take this one thing.
Sure, that's a great question. And of course, FDA is eager to see rules that we've enacted go into effect. I think, unfortunately, there's nothing that we can forecast or predict about the legal future of these rules if finalized or how any of that would play out. But I think the thing we keep coming back to is that the evidence base for these rules is extremely extensive and robust and has been subject to multiple forms and levels of peer review, both inside and outside of the agency, and is extremely strong and clear, not just of the need for these rules, but of the benefits of implementing them. So now is this really important phase for public comment and making the rules even better and even stronger, or figuring out the right steps forward with public comment and then moving forward from there. So thanks so much for the question.
And with that, this concludes today's stakeholder call. Thank you so much for the robust conversation. A recording will be available on the FDA's YouTube page in the next few days, and all of the relevant materials are posted on our FDA's website. If you have follow-up questions that weren't answered during today's session, please don't hesitate to contact the FDA Stakeholder Office. You can do that via our email box, which is fdastakeholders@fda.hhs.gov. Thank you so much.